Cancer remains the leading cause of cancer death in the U.S. and around the world, even as awareness of risk factors has grown. November is Lung Cancer Awareness Month, a good time to discuss why lung cancer continues to be a major health concern and what steps people can take to protect themselves. With us today is Dr. Saeed from Mercy Pulmonology Clinic. Dr. Saeed, thanks for being here today.
Thanks for having me.
So tell us, despite the decline in smoking rates, lung cancer is still the leading cause of cancer deaths. What factors contribute to this?
Yeah, you're absolutely correct. So declining rates of lung cancer in the 1950s, approximately 50% of the U.S. population was smoking. Now we're down to about 12%. But this decline is relatively new. So I think the effect of lung cancer decline in mortality will be visible a lot longer. There'll be a delayed effect, number one. A couple other factors involve the fact that, hey, lung cancer is a very silent disease, right? By the time we ever know that a person has lung cancer, it's already very late in the stage of the disease. So treatment options become limited. And that's why another contributing factor for increased mortality. And finally, of course, there are other risk factors associated with lung cancer, not just smoking alone.
Yeah, and we talked about smoking. What are some of those other risk factors?
Right, so approximately 10 to 15% of lung cancers are not associated with smoking. These include exposure to radon, which we've spoken about previously, exposure to asbestos. If you work in an occupation that has high exposure to diesel fumes, arsenic, asbestos, all these things are important risk factors. Additionally, if you live in a city which has very high air pollution and high particulate matter, that will also increase your risk for lung cancer as well.
And are there different types of lung cancer, some that are more aggressive than others?
Right, of course. So lung cancer broadly are divided into two major categories, small cell lung cancer and non-small cell lung cancer. Small cell lung cancer is probably the most aggressive form of lung cancer we have and accounts for approximately 15% of all lung cancers with limited treatment options. Whereas non-small cell lung cancers can be divided into adenocarcinoma, squamous, and other smaller types of cancers which are more treatable and less aggressive in nature.
Yeah, and on the treatment, can you tell us what does treatment look like, some of those options, and prevention as well?
Right, of course. So when we talk about treatment is, hey, the earlier the stage of the disease you catch it, the more options you have available. The earlier stage disease, you working towards a curative option. So you're working towards trying to do surgery or radiation to remove the cancer and to have cancer-free survival. In later stages of the disease, the treatment is more palliative in nature. We're controlling the spread of the disease and increasing life from that standpoint. That's from the treatment standpoint that we have available. And then we have chemotherapy, radiation, surgery, and immunotherapy, which is currently available.
Some different options. Dr. Saeed, thanks for being here today.
Thank you. Thank you.
And stay with TV9. We'll be right back.